I think with randomized controlled trials, you start to hit issues around external validity, for example. So if you look at the people who are enrolled in randomized controlled trials and the people that exist outside of them, they often don't match very well. You start to hit issues around post-market surveillance. So you perform the randomized controlled trial and you kind of let your guard down because it's made it through this gauntlet, so you presume it works. And so then you rely on people like Kaiser Permanente doing population health studies and finding that like Vioxx is killing people. And so we really need to rethink our notion of scientific evidence to be broader than just a randomized controlled trial. And in particular, you start to see, so randomized controlled trials can be powerful, and they're used in the consumer web in a very high throughput fashion. So we run very low cost, very high throughput controlled trials, like hundreds of thousands, if not millions a day, on sites like Google and Amazon and Facebook. And so bringing this notion of much lighter weight, higher throughput, so like shortening the cycle time on hypothesis to conclusion, I think would be very valuable to the healthcare system, but also additional work on robust causal inference in observational studies. So you see methods emerging from labs like Gary King's lab at Harvard and the Institute for Quantitative Social Sciences, and even Google has written some interesting papers on tools for doing robust causal inference in observational studies. And the reality is the vast majority of data that we have to analyze is observational in nature and not controlled. So let's build it's a challenge to the statistics community, and it's a challenge to the provider community to then know how to work with the results provided to us by the statistics community. So I think there's no silver bullet. It's not like there's something just over the horizon that once we figure it out, all of a sudden we're just going to unleash. I just think that we need to be open to evolving what is really just sort of a historical artifact. It's not like the randomized controlled trial is this thing that was like written in stone and handed to us. It's like over a century it has emerged as something that and it's now treated, I think, almost with the same amount of like veneration as religion, when in reality we need to treat it as just one way of learning about the world.